People trying to get an appointment at the University of Vermont Medical Center last year waited the longest for one. This was part of a big report when it came to extended wait times to see a doctor. Local 22's Dana Casulo is live in the newsroom with a look at what the Vermont Agency of Human Services found here. Dana?
Lauren, the report from the Agency of Human Services showed that half of the doctors in specialized fields in Vermont were booked ahead for weeks or even months. The Agency of Human Services spent last September through December studying the long wait times that Vermont patients endure.
Working together to make sure Vermonters have timely access to appropriate care is the primary goal moving forward for these findings.
The report showed wait times vary significantly within specialties.
With dermatology, neurology, psychiatry, and endocrinology services having the longest wait times depending on analysis.
It also showed wait times are similar regardless of insurance coverage type.
And that wait times were not longer for patients with Medicaid insurance in general.
And at more than 3 months, the University of Vermont Medical Center's average wait times were the highest in the state. The CEO of the UVM Health Network, Dr. John Brumstead, says there are reasons behind the delays.
One is workforce. We all know how hard it is, but to do everything we can to recruit and retain professionals.
The agency also conducted a secret shopper program to collect data. They called over 800 specialties acting as a Vermont consumer to see how long wait times were.
So for example, with dermatology, on the one hand, certain providers said they could see an individual within 11 days. A different provider said that would be 410 days.
CEOs from hospitals across the region say they haven't had time to look over the recent data that was released.
These are very complex issues, access to care and what type of care, what level of access you need. So we really need to be able to have some time to look at the methodology and the actual data and be able to compare that with what we know from our internal records.
The president and CEO of Northeastern Vermont Regional Hospital says housing has become a challenge when it comes to recruiting professionals to our environment. Reporting live in the newsroom, Dana Casulo, Local 22 News.